Hi, welcome to Detours Understanding Acquired Brain Injury. This is episode 2 for the infectious diseases of the brain for essentials of acquired brain injury. Today we're going to be talking about meningitis. We did briefly touch on it in the first episode when we were dealing with organisms and the different ways you can get meningitis, terminology, and when we were talking just in general terminology. Now I want to get more in depth. I have some notes. Because meningitis is so lethal, I want to be up to date with the latest information. So you'll pardon me if I have to periodically check notes. I just feel that, there are some new antibiotics in use and there are some new treatment protocols from when I went through schooling and was studying, and it's important to be up to date. I do want to stress two things before we get started. One, meningitis is especially bacterial meningitis, but all forms of meningitis are lethal. But bacterial meningitis kills, and it kills fast. If you think you or a loved one, anybody that you know of has meningitis, meets symptoms, or if you even feel it, you think they may have it, it is imperative that you get that person or yourself to the emergency department. This isn't, well, we can worry about this tomorrow or something like that. No, this is immediate kind of stuff. Call 911 or get them to the hospital. And if you think you have it, do not drive yourself. Call 911. Okay? This is one of those conditions that needs treatment immediately. We'll be getting into that in a little bit. But please, this is not something to fool around with. Secondly, do not use this video to substitute for medical care from a licensed physician or other provider. This is a YouTube video, right? Keep that in mind. It is meant as education, but it is not to substitute for proper care. As I said, meningitis kills. So please take this with the gravity that it deserves. Also, please do share this video for educational purposes, but do keep in mind it is a YouTube video and this is not a doctor's office. All right, so basically we talked about what meningitis is. It is an infection of the meninges, the coverings of the brain, specifically, typically the leptomeninges, which are the arachnoid and pia layers covering the brain. But there are two different ways of looking at it. There is infectious meningitis, and there is non-infectious or meningitis that comes from other causes that have nothing at all to do with organisms. We will get into that kind of thing at a later point due to the complexity of these two topics. The next video in the series will deal with encephalitis, all right, which is something else related, but that's another topic. But for now, we're going to talk about meningitis. Okay, so with regards to meningitis, it can be caused by all different kinds of infectious and non-infectious disorders. And so what are the kind of risk factors that a person who's exposed could have? I mean, you can have chronic medical disorders. Even things like diabetes increases your risks. Obviously, things like HIV or being immunocompromised, people with weakened immune system, age plays a role. If you have traumatic brain injury, that can play a role where you live. If you live in areas where disease-causing organisms are obviously more prevalent, if you've had surgery, that puts you at risk. Sinus surgery, increases your risk. If you have a skull fracture, of course, that has a risk. If you live in crowded conditions. This also is an increased risk if you think about like school students, or if you're prison. I don't mean to mix the two, but if you ask plenty of students, they'll argue it's prison. But if you travel to certain countries, that also increases your risk. As I said, exposure to certain insects. Arboviruses can cause viral meningitis too. So, zoonoses, diseases spread by animals. Extremes of age, babies and the elderly. If you're not vaccinated, certain diseases that can cause meningitis, you can get a vaccine against them. So it's important, especially for the young and those who are going to be going to school, if you're going to be living on campus, or if you're going to be traveling, to get vaccines against the certain viruses and bacteria cause. Obviously, if you have an immune problem, your body may have difficulty using the exposure to the antigen in defending you, in presenting it to the T cells, and then retaining it in the memory B cells. We don't have to get into that, but basically, if you have immune compromise, you may find that the vaccine is not as effective. But it's important to keep that in mind. So obviously, people with alcoholism, they're at higher risk. Again, it affects the immune system a variety of ways. If you have cancer, that in and of itself can trigger meningitis of a non-infectious type. Neoplasm, so people with cancer, paraneoplastic syndrome, and some of these other forms of meningitis, they're at risk for that as well. Sickle cell anemia, if they've had to take your spleen. So there are a broad variety of different factors that increase your risk. However, the important thing to remember is, even if you don't have any of these, you can still get meningitis. Even if you don't have any of these risk factors, you still have a chance of getting it, okay? That's what I want to get to. Okay, so what is incidence? About 2 per 100,000, or reduced at about 1 in 50,000. Fatalities, that depends on how quick you get your treatment. Untreated, it depends on the organism again, typically from anywhere from about 15 to as high as 70%. Again, it depends on what you got. It depends on your defenses, things like that. So again, this is why it's found all over the world. Some countries obviously are at much higher risk than others, but so it's like, know where you're going, know what your medical risks are when you travel. And for those of us with brain injury of another sort, we are at higher risks of getting infectious meningitis. Okay, so you're already, and if you get something like sepsis, your chances are much higher of ending up with infectious meningitis. So this is something to keep in mind, all right? So what are the most common causes? This is something for which I have a list. So Streptococcus, that's the most common bacterial cause of meningitis. So, and by the way, that would be both strep sources, pneumoniae and strep B. Neisseria, meningitis, H. influenzae. That used to be the #1, but thanks to vaccinations against that, that number has gone down, and that'll be one of the common vaccines a lot of kids get. So it's important to keep that in mind. And listeria. That can come from unpasteurized milk, for example, and that is very damaging as well. This is part of why we pasteurize. I actually know someone who's had meningitis because of it, and still does have some serious neurological symptoms because of it. So please, pasteurized milk, that's important. It kills off organisms like this. But those are the most common bacterial causes. Also, you can get it from other bacteria, like staph. That's less common, but it does happen. So it'll be more about recognizing symptoms as opposed to worrying about specific bacteria. Tuberculosis bacteria, tuberculate, as the anti-tuberculosis drugs are not as effective anymore as they used to be, as they're searching for new ones. we may see a return of a tuberculosis-based meningitis. Something to keep in mind also, because we're starting to run short on the traditional antibiotics. Good news is there are some new ones in the pipeline, but they're being more conservative with those. So we have to be aware that we may see the return of some older organisms, and that you know, that they're going to be, it's going to take longer to get them onto the market. And so we may start to see other ones that were once killed by antibiotics easily take longer before we see new antibiotics against them. Okay, so also keep in mind there are viruses, and let me just make sure I touch on all of them. I mean, the number one most common cause of the viral types are cocciviruses and are echoviruses. Herpes virus is the number one cause of encephalitis. We're not talking about encephalitis, we'll get to that later. But viruses can also cause meningitis. And there are causes of both meningoencephalitis, where you get an infection, as I referred to in the last video, about infection both of the meninges as well as the brain tissue, the parenchyma itself. That's meningoencephalitis or encephalomeningitis. It can be labeled the other way, it doesn't matter. Measles, flu virus, almost any of these, the arboviruses, so anything that's a zoonosis transmitted, can infect the meninges and not brain tissue. Again, a lot of these factors come into play as far as where it decides to set up shop. Fungal meningitis. Now, fungal meningitis is more often seen in immunocompromised patients, patients with HIV, patients that are on long-term steroid treatments, patients that are bone marrow recipients for cancer, for leukemia, so kids are at risk of this one, or babies, or the extremely elderly, whose immune systems are not as functional or aren't developed yet. They are also at risk. So, excuse me. So what are the fungal causes? Again, another list here. Cryptococcus. There is an antifungal medication for this one. Coccides, Aspergillus, Candida. That's one some of you might be familiar with, depending. But again, the people who are most vulnerable tend to be those with immunocompromise. But again, it can happen if you have surgery, you're at risk. If they have to crack open your head, or if they have to go into your sinuses, it's an increased risk. You go swimming, and you get something up in there. No, Enfalleri is not. No, that is one of the protistas. Remember, we talked about that trash can fire category. That's something else. And mucormycoplasmosis, or mucormycosis. That's a hard one to say, but that one is more common in diabetic patients. Those with diabetes, you tend to see this one as a cause for meningitis, and transplant patients. And usually this is another one that is direct extension of sinus type infection. So what is the way that this gets into the meninges, that these infectious organisms get in there? Two ways. One, I just alluded to, which is that the bacteria is spread into the nose, up into the nasopharyngeal area. So up in here, sinuses, and then get up into the brain, passing through the olfactory bulbs and up into the meninges, up that way. Most common. Second way is it gets into the cerebrospinal fluid. It does that either by surgery, crack open your head, or it can get in there through skull fracture, or through your ears, a transfer that way, or a penetrating object, bullet, knife, something penetrates, you're doing a construction project. So that's the other way it gets there. It can show up in a variety of different ways, meningitis. Usually there are three things that you're kind of looking for. And these symptoms typically will stand out. And it doesn't matter whether it's bacterial meningitis, viral meningitis, whether it's fungal, whatever. Three things. So, severe headache. You'll also typically have high fever, and you'll have meningeal symptoms. Now, what do I mean by that? So, meningeal symptoms include things like stiff neck. So, they won't be able to and they also later on will have two important things that you can assess for. Patient where you think it is, you could take them, you could like flex them at their knee and try to bend it. This is called Kreenig's sign. You try to straighten their knee, and due to pain and tension, you won't be able to straighten their knee. Kreenig's sign. And Brzezinski's sign is if you were to try to flex their head, their leg will come up and kind of flex. This is not present in everybody, especially those without immune, without a proper functioning immune system. And also, it's kind of a later sign. So if you see this, they're in trouble. Whether you could test for Kreenig or Brzezinski's, but it is specific for meningitis. So if you do see this, yeah, you know you're in trouble. But another way to test, or thing you can test for, is have them turn their head side to side. If that hurts like crazy, if that makes their headache worse, yeah, that's also a red flag too. So if they do this and their headache's a lot worse because putting tension on the, yeah. So that's also a red flag. Some other signs and symptoms, but a quick note. About 50% of patients have all three signs, have a severe headache, have a fever, which also may not be present if they're immunocompromised, and also have the meningeal signs, nuchal rigidity. And many elderly, people assume, especially like in a nursing home or wherever, that it's just, arthritis. But because it could also be meningitis, and if they typically don't complain about that, you need to be wary. But those three symptoms, the neck stiffness, the fever, and the headache, if you see that, that's pretty much a deadlock. But it doesn't, you don't always see them together. There are some other symptoms that are common, especially depending on what kind of organism it is. Photophobia, very sensitive to bright light, just like a migraine. So really sensitive to bright light, or phonophobia. Altered level of consciousness. This is common too. They're kind of out of it. So if the person you're dealing with is not with it, is kind of, that's bad too. That is another red flag, because they may have swelling in their brain. They may have edema. If you remember, we talk about edema a lot. So if they have an altered level of consciousness, that's a serious problem, and may be also indicative. They may be nauseous, vomiting. So these kind of symptoms. And in some cases, they may also have a rash like this. The thing about that rash, it's called a petechial rash. And basically what it is a rupture of small blood vessels. This rash is non-blanchable, meaning if you push on it, it won't change colors, it won't white out, it won't kind of disappear. If you roll a glass across it, that's not going to, it's like one of the tricks to check it. If you roll a glass, it won't change, it won't distort it or anything like that. This is a problem too. Bacterial meningitis. These are common symptoms. Not everyone gets all of them, but if you see these, get thee to a hospital. Okay? Especially the fever, the headache. Headache's always present. The altered level of consciousness, neck stiffness. One or two of these, even if you see them persistent, because people with a suppressed immune system, and there are things to keep in mind. You know, there are things that should increase your suspicions. If they're in a crowded living space, again, students, you know, if they're at university or if they're in jail, or if, you know, there's a whole lot of kids, and maybe you got like, you know, you've got 5 kids, that's a red flag. If they haven't been vaccinated against this, if they just had flu-like symptoms before, because meningitis may start with flu-like symptoms, and then suddenly they start showing these signs, that's a warning. So, you know, if they're immunosuppressed, so if you know they're taking a lot of steroids or they're taking other medications, anti-transplants, things like that, that's something to keep in mind. Or if they're young or very old, again, and you see any of these kind of things, that is a red flag. Get thee to a hospital. You know, children younger than, say, 4, 5, or people older than, say, 70, 60, 70, you know, whatever. And again, if you see these pop up, if they're chronic alcohol users, drug users, hospital, if you see these pop up, you need to know, have they been bitten? Did an animal bite them? I'm not talking about rabies here, but, you know, it's like, were they stung? Were they, a mosquito got them? Tick got them? So really important. Time of year. Certain diseases happen better when it's warmer, whereas flu-based meningitis happens when we're more crowded together. So, you know, these are useful things also to tell a physician. So, as I said about, you know, Brzezinski, Koenigs, but they're kind of late. One other thing is, do they have any, like, cranial nerve signs? Do you notice that, you know, their eyes drooping, eyelids drooping, a mouth drooping? Do they have trouble talking? In severe cases, they may have a seizure. This is definitely a red flag. Or if they can't talk, if they're having trouble remembering. This is not as common, but it is most definitely a get me to the hospital sign, okay? These kind of cranial nerve abnormalities happen in about 20% to 30% of patients. And again, depends on the organism. So, what do we do? What is it that happens when we get the patient to the hospital? Usually, we need to look at their cerebrospinal fluid. So we'll need to do a spinal tap to look at the fluid. And that will help us identify the kind of organisms with which we are dealing. However, in order to prevent the risk of herniation of the brain, we've talked about that, usually a rapid CT scan. The fast CT scan to make sure that they are not herniating first. So they'll toss them in the CT scanner and clear them. It doesn't guarantee that it can't happen, but it does decrease the likelihood. Then they'll do a spinal tap next and try to isolate the organism. Okay? Different numbers, and try to find out what organism it is. What virus, what bacteria, what fungi, what protista. Any of that good stuff, right away.
Tamam, yavaş, yavaş. Biraz hissedeceksin, tamam mı? Birazcık hissedeceksin. Getirebilirsin şeyi.
Hiç sarıp almayacağız mı? Sarıp.
Yeter mi?
A lot of times what they will do is they will start, different kinds of antibiotics. For kids, especially for neonatal up to about a month or two, they'll use a third generation antibiotic, and they will also then sometimes use broad spectrum antibiotic. They may also give them an antiviral as well, because again, they don't know what it is right away. It may take a few days to identify the organism. So they'll give them a third generation antibiotic. They'll give them an antiviral. They will give them sometimes even throw in an antifungal just in case. Fluid support, maybe steroids. The research is kind of on this. And then, once they've isolated the organism specifically, then they give specific treatment. Long-term effects. Sensory neural hearing loss. Cochlear implants may be necessary. Visual impairment. Learning disabilities or intellectual impairment, especially in kids. They may end up losing IQ points on this one, and a bunch. This is why, especially with kids, it's so necessary to get them help. Psychiatric disorders, kids and adults. Seizures. This is all after recovery, if you survive, because that's the first challenge. Problems with reading, writing, agnosias, focal deficits. So specific language problems, perhaps talking, specific issues with writing, or, other localized, but problems with coordination. If it hits the cerebellum, you may have trouble moving, coordinating movements. These are regardless of whether it's bacterial, fungal, viral, from one of the protista. Doesn't matter. N. fowleri is, like I said, from one of the protists, primary amoebic meningoencephalopathy. We'll talk about that later, but it's like rather graphic because it has a high mortality rate. All meningitis has a high mortality rate. It's just less traumatized by the news. It is important this is a public health threat, and this is a significant source of permanent neurological disability and acquired brain injury, meningitis. It is a long-term disabler of children and adults, as is encephalitis, which we'll get to in the next video. But I want to stress again, if you think somebody you love, has this as a problem, 911, go to the emergency department. This is not something to fool around with, or I think I know, let's. It is better to have a false negative, or to have a false positive, to be wrong about it being and it being nothing. Then a false negative where you dismiss something that is. Because this kills. And I could say it a million times and it's still not enough. This is one of those conditions about which whether you die from it or are permanently disabled from it, it can leave you with symptoms as bad, if not worse, than severe traumatic brain injury. It can leave you stuck in a nursing home or in a situation, and recovery is long, slow, and hard. So I just want to, again, nail home how bad this can be. Memory loss and other things too. This kind of grim, and so is encephalitis, but these need to be addressed too. If you have any questions, anything that I can answer for you or anyone else, please message below. Please click like, subscribe. Please share. Don't forget to visit our website, Friends with Brain Injury. Don't forget to check out our Facebook of the same name. Share your stories. If you have anything to add, if you or someone you know wishes to share a story about meningitis or encephalitis, please share. And have a good day. Bye.